So basically, when a disease spreads throughout the continents and is presumed to be continuing all over the world, it is called as pandemic. Now, what we need to understand is that pandemics have been present throughout the human civilization. It has shaped the course of the human civilization. And if you are an ardent reader of the history, you will understand that how various civilizations from the European to the Middle Eastern civilization, they rose, they fell, and then regrouped. And all have been collectively influenced by diseases. And these diseases actually spread from one continent to the other. Furthermore, if you have heard about Sir William Osler, in one of his dictum, he has said that perhaps the greatest curse on humanity are three things. One is fever, that means diseases, famine, and war. So, throughout the human civilization, you will find that these three things have actually influenced everything. Wars were followed by famine, diseases followed by famine, and then there is a regroup and restructuring of the civilization in itself. Having said that, we'll just look into how many pandemics we have actually witnessed throughout the history till now. Now, this is a representative diagram. If you see, this is a brief diagrammatic representation of the history of the pandemics, where the sizes of the microorganisms actually indicate the human casualty that has happened. Now, let us look at it one by one, very briefly. The first evidenced pandemic was something called as the Antonine plague. Now keep in mind, at that point of time, plague means a disease which is capable of killing huge number of people. Later on, a particular disease was named as plague. Okay. So it actually happened in 1605 AD, and it was one of the many reasons of the fall of the Roman Empire. And it is presumed that this disease was actually smallpox. Moving on, still in the Roman era, we have something called as the Justinian plague. Now, this is still in the Roman era. Now, over here, the disease was actually plague, or more precisely, it was the bubonic plague. And this pandemic actually shaped the history, had a huge effect on the history, as it not only led to the fall of the Roman Empire but also limited the expansion of the Byzantine Empire. Obviously, you can relate to this if you have actually studied history. Now, moving on, few years more, in 1346, we have the Black Death. This is plague in all actions. That means the earlier pandemics where we have witnessed were the bubonic type of the plague. But in this pandemic, they were evidenced with every part of the plague. That means not only bubonic but also septicemic and pneumonic. And this Black Death actually killed huge number of the people, especially in the Europe. Thereafter, during the colonization of various countries, including the Americas, North and the South Americas, the Africas, and the Asia, these European countries actually spread out into these areas. Now, over there, two things actually happened. The first thing that happened was the various diseases which the European population had never exposed, they got exposed to. Similarly, the Native Americans, they got exposed to the European diseases. And hence this terminology comes as the New World and the Old World. Old World means the European diseases and the New World means the diseases which are prevalent in the Americas. Now this had a twin effect. For example, smallpox was transmitted from the Europe to the Americas, and that led to almost extinction of many American civilization, including the Aztecs, the Incas, and even the native Indian Americans. Similarly, one interesting disease also came back to the Europe from the Americas, and it is presumed that disease actually originated from the Americas, and this disease was syphilis. Now, it was carried from the Americas by the colonizers of the Europe, and it spread throughout the Europe. And the naming of the disease you will find very interesting. The Italians, the Germans, and the English, they called the disease as the French disease, whereas the Dutch and the Portuguese, they named it as the Spanish disease. Then the Eastern Europeans called it as the Polish or the German disease. And over in Asia, The Japanese called it as a Canton rash or Chinese disease. So actually, every country tried to blame one another for this disease. And this syphilis ended up spreading throughout the Europe, and it was also called as the Great Pox, differentiating itself from the earlier epidemics of smallpox. Now, moving on, the next kind of pandemic that actually wreaked havoc over the world is called as the third cholera pandemic. If we look at the history of the cholera, there are 7 pandemics. Okay, but what is interesting about this third cholera pandemic was that it started, presumably started from India in the Ganges belt and spread out to the Europe, the Africas, and even up to the Americas, also including the Asia. And during this pandemic, a very interesting thing happened. I think you are already aware the concept of safe water prohibition that was put forward by Dr. John Snow in his study in London. And this actually shaped a very interesting concept that we have been teaching or advocating for is something called as the various infection control practices for uh, stopping of the spread of the disease. Furthermore, after the third cholera pandemic, another interesting disease actually spread that is called as the typhus fever, also called as the jail fever or camp fever. Most of these fever were actually seen in people who were in hospitals, in refugee camps, in military barracks. Now, next pandemic that the humanity witnessed were in the late 1800s. That was the first pandemic of influenza virus, and it was called as the flu virus. At that point of time, the human beings were actually not many diagnostic tests was done, but this disease actually spread throughout the Europe and the Americas. Moving on, after the flu pandemic, immediately after the flu pandemic, what we witnessed was called as the sixth cholera pandemic. And again, like the third cholera pandemic, it spread out almost throughout the world. And by the time of the First World War, if you look at the date, 1918, almost simultaneously during the First World War, we witnessed another flu epidemic and pandemic. And this was also misnomerly called as the Spanish flu, but nevertheless, it killed huge number of the people. Moving further on, by the 1900s, we have witnessed various pandemics, predominantly of the viral origin with the Asian flu, another H1 influenza, the Hong Kong flu, the variants of the virus. Then in the 1980s, and still today, we are witnessing a pandemic of HIV, which is spreading almost undetected throughout all population of the world. And finally, I think you are all aware in 2019, another pandemic was witnessed that led to almost lockdown of the all of the world, and that is called as the COVID-19 pandemic or SARS coronavirus 2. Okay, so these were the various pandemics that actually we have witnessed throughout the civilization. Now, question is what we should do about it and what we should learn about it. We have learned about the history, how it had affected the human population, how it affected the history, the civilization, etc. and etc. Now, look at this picture. What does it show? What is the difference between pandemic and epidemic? Epidemic is when a disease is spreading across a population in a particular geographical area. Now, when this disease spreads the geographical barrier and spreads to other areas, we call it as pandemic. That means every epidemic is a potential pandemic. So, if we can limit the spread of the disease, we can halt the progression. Otherwise, we cannot. Now, throughout the history, if we look at the spread of the pandemics, most of the pandemics spread with two important aspects. The first aspect is trading, where ships were used to transport goods and human beings from one part of the world to the other part of the world, and they transmitted the disease. It could be rats spreading the plague, or it could be human beings or their clothes spreading smallpox, etc., or human beings themselves, as in the case of syphilis. And in today's world, this is a picture which shows the air travel between the continents on a daily basis. That means in today's world, people are traveling and commodities are being transported from one part of the world like never before. So the chances of an epidemic transforming into a pandemic is extremely high in today's world. And one more important aspect of this pandemic discussion that you must understand is the triad of the disease. What is the triad of the disease? For a disease to happen and spread, you need an agent, you need the host in which the organism can cause the disease, and it should also have an ideal environment for the spread. Now, why this is important? Because whenever we do understand how the disease spreads or causes the disease, we can interrupt the transmission by interrupting this chain. If we can prevent the pathogen from entering into another host, or if we can prevent the ideal environment, or if we can separate the host, then we can actually stop the disease from spreading. Now, this is the basis of all the maneuvers that we take in controlling an epidemic or pandemic. Have you understood this? Okay. Moving on. Now, this is a pictorial description of the three main aspects. Something called as an endemic disease. What kind of disease we call as endemic? Endemic disease means a disease which is present in the local population throughout, but in a number that is not significant. That means that is something that doesn't bother people too much. That is we call as endemic. But when the same disease occurs in the same geographical population and it becomes bothersome, that means the number of the cases increases more than what is expected or what should be. We call it as epidemic. Similarly, when this disease spreads to other part of the areas where most of the population have actually not encountered the disease, we call it as a pandemic. Well, now few more definitions that you must be aware whenever you are concerned about the diseases. The first definition that you must understand is something called as cluster. So what is a cluster? A cluster is an aggregation of cases grouped in place and time that appears greater than expected. So let me explain to you. I think you must be aware that in the monsoon season, it is expected to have respiratory viral infections. But suppose in this group, suddenly almost say about 70 to 80 people get infected with a viral disease and they start to have a symptom. Then we call it as a cluster. That means at a particular time and place, more people than expected are having a particular disease, then we call it as a cluster. Then what is an outbreak? Outbreak means again when huge number of people been affected, but the important is it is more than the expected in a defined group of population. That means if we count the number of the cases, mathematically speaking, if the number of cases are more than 2 standard deviations, then if this number of cases more than 2 standard deviations for a huge geographical area, we call it as epidemic, and if it spread across the continents, we call it as pandemic. And lastly, there is something called as PHEIC, that is Public Health Emergency of International Concern. Now, what is this? You see, WHO actually monitors the various diseases all over the world. There are many diseases which are present in one continent and not present in other areas. But yet WHO categorically speaks out that there are some diseases called as PHEIC. Now, why does WHO does that? The best example is Ebola virus. Most, if you have read about it, Ebola virus infections are most commonly seen in Africa. So it is generally not expected that this disease will happen in India. But yet, if you look at the immigration and the embassy reports, huge number of people are moving to Africa and huge number of people are moving back to India from Africa. So there is a high probability that one person may actually spread the disease in India. So during the travel, this disease has to be scrutinized. A similar very good example would be what Indian government does is something, a disease called as yellow fever. The disease is not present in India. So the Indian government mandates that people moving to Africa should be vaccinated against yellow fever, and people who are coming back from Africa to India, they should be screened for yellow fever again. The whole objective is to prevent the transmission from these countries to India. Okay, now look at this chart. Now, what does this chart describes? Now, suppose we take an example of the recent pandemic that has happened, that is the COVID-19 pandemic. I think most of you have experienced this pandemic personally, so I think you can relate it very much. Now, first line, what you can see, initially there are cases which are not significant. Then the cases start to rise to such an extent that the authorities start issuing alert notices. That means cases increase more than 2 standard deviation. That's when it is defined as an epidemic outbreak or an epidemic. Then comes the pandemic phase, where the disease has spread out to various different areas. Now try to recall what happened in the COVID pandemic. Initially, the epidemic happened in China, then it spread out from China to other countries, and then from the Indian perspective, huge number of cases started to rise. The Indian government then issued the alert notices, and then it spread out like an epidemic. After that, what happens is, if the disease is very severe, many people do succumb to it. The disease spreads out, people lose their lives, the number of cases goes down, and many a times we can find another peak of the cases. This is called as the transition phase. In case of COVID pandemic, you have heard about the first wave, the second wave, the third wave. So these are the transition phases where the number of the cases rises after initially going down. Thereafter, the number of the cases goes down, and we assume that the pandemic is over. Even though there might be small number of cases, is called as again the inter-pandemic phase. Have you understood what are the phases of the pandemic? Now, why it is called as an inter-pandemic phase? Because when the number of cases go down, then we wait for another disease or another pandemic to rise up. Now, having understood these phases of pandemic, based on these phases, we can find something called as the points of intervention. That is, where we can actually act upon so that we can actually control the disease and the number of the cases. Now, what are these areas? In the inter-pandemic phase, that means right now where today we are, we have experienced a pandemic, yet another pandemic has not come ahead of us. So this is called as an inter-pandemic phase. So this is the phase where we can work for pandemic preparedness. We can get ourselves prepared as a country, as a nation, to improve our infrastructure, our knowledge, so that we can be prepared for any kind of a pandemic that may happen in the near future. This is called as preparedness. Now next, suppose another disease starts to increase in number. That means we are finding cases more than what should be expected. This is the phase where we call it as a response phase. If we look back in 2019, 2020, when the disease COVID-19 spread throughout the country, the government of India took some measures to control the disease. A most notable measure was implementation of lockdown, social distancing, so that the people get less and less exposed, hence the number of the cases can be controlled. That is called as pandemic response. And after the COVID-19 pandemic has spread out, then the health authorities had then prescribed various kinds of medication, from ivermectin to chloroquine, I think to even remdesivir, various kinds of drugs for as treatment. And thereafter, even we found out that we had actually licensed a vaccine against COVID, and almost all of India people were vaccinated against the disease. So this is called as the stage. Thereafter, we have reduced number of cases, and this is the stage of the recovery. And after the recovery, when the pandemic ends, then we again look back what has happened and what could have been done better and what preparedness can be done, and then we have to prepare for the next pandemic. So this is how this cycle of pandemic works. Okay, now what kind of diseases do you expect for a pandemic in the near future? The history has told us that with the evolution, various microorganism has caused a disease leading to pandemics, be it a bacteria, be it a virus, etc. and etc. Now, what kind of diseases we can find out? We can actually classify them into two types. The first is called as emerging diseases. A very notable example would be COVID-19. Most of the people all over the world were not aware of this SARS coronavirus. It's a completely new virus, caused infection, caused a pandemic. So this is called as an emerging diseases. And another group we have something called as re-emerging diseases. Now what are re-emerging diseases? For example, in India, we have a disease which has been prevalent from many years, many years. That disease is called as tuberculosis. People have been affected, the government have made policies, they have implemented the policies, the number of cases have gone down. That's a good thing. But now in today's era, we are seeing something called as drug-resistant tuberculosis. The number of the cases of drug-resistant tuberculosis are increasing day by day. So the disease is not a new disease, but the problem has become a new problem. Similar diseases like malaria, now we are experiencing drug-resistant malaria. So these are the diseases which are re-emerging, or it may be even cases of diphtheria. Most of the people are vaccinated for diphtheria, but as the people grow old, they lose their immunity to diphtheria, and especially in the elder group, we can find diphtheria cases, which was earlier more associated with children. So these are the various kinds of diseases where, if we look at worldwide, we can find many cases from multi-drug resistant tuberculosis to drug resistant malaria, SARS coronavirus, mutations of the influenza virus, various mutations, and if you heard about recently, the human monkeypox virus actually spread in huge number in this case scenario also. So these are the very few examples of the emerging and re-emerging diseases which may actually pose a challenge for us in the near future. Now, what does the world does to prevent the pandemics? We have an organization called as WHO, or World Health Organization. This monitors the various diseases, whether the number of the diseases are increasing or not, and it is actually the job of the WHO to declare a disease, whether it's a PHEIC or a public health of international concern, or it's an epidemic or an outbreak or a cluster. WHO actually defines. More than that, the WHO does even more significant part, which include it grades the severity of the disease and the effect on the human population. Then it also deploys field teams to investigate, to cure the patients. Then it communicates to the local authorities and international authorities. It leads to the global organized effort so as to implement the various health structure facilities. If you do go and search for it, the Indian government does many this kind of activities, especially in countries like Africa or even in Latin America. The Indian government sends out its medical facilities, the doctors, healthcare teams to actually help out these countries in these cases concerned. The ultimate objective is to limit the cases and limit the spread of the disease. A similar kind of work is done in India by this group called as the ICMR, or the Indian Council of Medical Research. It monitors the various diseases or cases in India, and if the number of cases rises, it notifies the government so that both the state and the central government, and including various managements like the disaster management system, they take the work and try to limit the cases in India. Now, again, let us look at this chain. What is this chain? This is the chain of transmission of disease. Here is the infectious agent. It actually is present in the reservoir. From the reservoir, it goes from the portal of exit to the susceptible host, to the mode of transmission. Into the host, it enters to the portal of entry and affects the susceptible population. And then the cycle repeats on, so that a huge number of people may be affected. So if we need to stop the transmission of the disease, what we need to do is we need to interrupt this chain of transmission. How can we do that? Any ideas? How can we stop the agent? Well, we can treat the patients. For example, if it's a bacterial disease, we can give antibiotics, thereby killing the organism, or we can give the susceptible population vaccines so that they are not affected. We can remove the reservoir. A very good example would be in case of malaria. If we actually prevent the breeding of the mosquitoes, we can reduce the number of the cases. Then we can stop the portal of exit. Again, a very good example would be malaria. If we use mosquito nets, if we don't venture into the forest, if we prevent ourselves from getting bitten by mosquitoes, we actually don't acquire the plasmodium parasite. Then, mode of transmission. Again, if we kill the mosquitoes, then the transmission is interrupted. Then, in case of susceptible host, if we give the anti-malarial drugs after detection of the malaria in this patient as early as possible, then we can stop the spread of malaria from human beings to other human beings. So, there are various aspects in which we can stop the transmission. Now, one more important aspect that you should understand is cases. So, whenever an outbreak or an epidemic or a pandemic happens, we need to identify the people who are affected. How can we identify? They are diseased person, so we need to diagnose these cases, right? Now, every time laboratory diagnosis may not be possible, or sometimes the laboratory diagnosis may not be there at all. So, we actually classify the cases into three types. The first type is called as symptomatic cases. Next is called as presumptive cases, and then lab confirmed cases. Now, let us take an example of, say, in this monsoon season, there are a huge number of cases of malaria. So, how can we classify these things based on that? Suppose if you go and venture into the community, in a household, out of 5 people, 3 people are actually suffering from fever. So, fever is a very important symptom in case of malaria. So, your suspected cases would be all people suffering from fever. So, that will be your symptomatic cases. Now, among the 3 people who are having fever, 2 of them gives a history of high rise of fever every day or every alternate day with after episode of chill and rigor, the fever subsides. So, this is a typical description of malaria. Now, that gives us what we can conclude, this may be a high probability. So, that is called as presumptive malaria. Okay. So, out of the 3 people, we can presume that 2 of them have malaria. Now, if we take the blood samples of these 2 patients and send it to the laboratory for either peripheral blood smear or an antigen test, and those are confirmed by the laboratory, then we call it as laboratory confirmed cases. Okay. So, when we try to approach the community, we must differentiate the cases into symptomatic, presumptive or laboratory confirmed cases. Moving on, few more important aspects that you should understand about inhibition of the chain of transmission. The first concept is differentiation between isolation and quarantine. What is an isolation? When we restrict the movement of the patient, we call it as isolation. The patient is affected, we are trying to prevent the infection from transmitting from the patient to the healthy individuals, and we restrict this patient to a particular area, we call it as isolation. Understood? This is the reason why in the hospital you will find isolation ward or isolation bed. That means affected patients are kept in isolation ward. Okay. Then what is quarantine? Quarantine is not a new concept, it's a very, very old concept. Started with the Italians. What the Italians did, when the ships which has ventured out for trading to another country, they entered into the ports, the ships were not allowed to deboard. The shipmen were not allowed to deboard in the port before completing their quarantine. That means the shipmen were to live on the ship right in the port for a minimum number of days, then only they will be allowed to mix with the community. And if they survived or they were not diseased by that time, then only they were allowed. So, this is called as quarantine. And nowadays what we do is, suppose you come in contact with another patient. Till now you are not diseased, but there is a probability that you may get the disease. So, to prevent the transmission, what you should do is you should restrict your movement in the community. But because you are not diseased, you are not admitted in the hospital. So, you will stay in your home for a particular number of days. That is called as quarantine. I think during the COVID pandemic, many of us have been quarantined for a period of time. Next comes something called as social distancing. Now, what is this social distancing? Social distancing means you must keep people away from each other, not a physical measure of distance. It is to prevent the chain of transmission. For example, if a disease is spread mainly through droplet infection, a 3-meter social distancing is enough. But if a disease is spread through airborne, that is not enough. So, depending on the transmission of the disease, this concept of social distancing will be there. Another thing that we have to do is something called as contact tracing. What is this contact tracing? That means all the people who have been exposed to the disease must be tested so that before they are declared as not diseased. For example, suppose in this group, one person gets measles infection. Measles is an airborne disease, right? So if that person coughs or sneezes in this hall itself, everyone will be affected. So if I need to trace everyone who are affected, how can we trace? First, we need to look at where the exposure has happened, who are the people who are present at that point of time, and we need to test each and every one of them. That is called as contact tracing. Again, for example, if it's a sexually transmitted disease, we need to take the history of the people who have come in contact sexually to the affected person and test each and every person. Next, another thing is called as containment zone. Have you seen this picture? The left hand side, especially in the COVID pandemic? Yes or no? I think you have seen this picture where if many cases were done in a particular locality, the authorities will put up a board like this: containment zone, entry and exit is restricted, so that people should not move in and move out, other than the people who have their own interest, like the healthcare officials. Again, this is a measure to prevent the transmission. Next, during this pandemic, how many of you have been tested for COVID? If you had been tested, you would find that the people who are taking the samples what was their getup? They used to wear a PPE with the mask, the gloves, and the protective eyewear, the full personal protective equipment before taking the sample. That means all the healthcare workers, including us, should put personal protective equipments before doing anything, including sample collection or treatment of the patient, and even cremation. Cremation means after the patient succumbs to the illness, the patient body has to be cremated or even buried. So whatever may be the process of cremation, that cremation should also be undertaken with proper personal protective equipment, so that the disease or the dead body of the patient do not transmit the diseases. And during the healthcare, from sample collection to the treatment, we do generate biomedical waste. This is another source of transmission of disease. So doing all these things, we have to also keep in mind of the biomedical waste management. A very important concept of interrupting the spread of the disease is called as herd immunity. What is herd immunity? It is the immunity of the human beings as a community or as a unit. Some people are more resistant to some of the diseases, some are not. I think you have heard about sickle cell anemia. People with sickle cell disease are very resistant to various cases of malaria. So this disease were more prevalent in areas with the malaria. So those people are more resistant to malaria as compared to some of the other people. So what is needed to be done is, if we increase the immunity of the people of the community as a whole, we can interrupt the transmission of the disease. The same kind of thing happened with the COVID pandemic, where everyone was vaccinated with the vaccine so that the people start to have antibodies in their body against this virus. So the number of the cases can interrupt and the people may not be affected. So this is called as the herd immunity. Now finally, coming to the treatment, and including the vaccines, all drugs or vaccines that has to be used on human beings has to go through these phases of clinical trials. In your pharmacology classes, I think you have already read about these trials. Basically, we have the laboratory-based studies in which the molecules study both in the in vitro and in the laboratory animal model, and thereafter it is studies on human population in these five phases from 0 to phase 4. After they are cleared from the phase 4 trials, the drugs, including the vaccines, can be used on the human population. But there are some exceptions. One of the exceptions is a pandemic. Like in the COVID pandemic, various drugs were treated or used for treatment of the patient. Not all of them had gone through the all phases of the trial, but because of the need of the hour, these drugs were used, even including the vaccines. And some of the repercussions of the vaccines are still going on, even about 5 to 6 years hence. Now, in your previous classes, you have already been acquainted with something called as outbreak investigation. The same thing also happens during an epidemic. We call it as investigation of an epidemic. So, what this investigation of epidemic is, earlier I have already told you, say the WHO worldwide or the ICMR in India, it sends a team of healthcare officials wherever it suspects there is a potential chance of outbreak. So what this team does, they investigate for an outbreak or an epidemic. There are 11 steps, but none of the steps are done one after another, they are all done simultaneously. I'll just very briefly go through the steps of epidemic investigation. The first thing is to be done is the verification of diagnosis. That means the disease is actually happening in most of the people, both mathematically and by the laboratory confirmation. After we establish that the disease is actually happening, we need to confirm the existence of epidemic. That means assess how many people are affected, whether the number of the cases are indeed higher than expected. After that, we must assess what is the population at risk, who are the people who may get infected later on. Thereafter, all the aspects of the disease has to be researched as early as possible. That will lead us to two very important parts, the data analysis and formulation of hypothesis. When we do a descriptive epidemiology, the data can lead us to formation of a hypothesis, how the disease is occurring, what could be the mode of transmission, what could be the disease agent. And this will lead us to the examples, that is testing of the hypothesis with the help of intervention. The drugs that we can give, the vaccines that we can give or we may not give, what are the physical measures we can take for interruption of the transmission based on the ecological factor. Then we must investigate the population at risk also, whether they are actually indeed affected, even after the intervention is done or not. And finally, we must write up the whole report as a whole. So these are the various steps of an investigation of an epidemic. In India, we have a body called as IDSP or Integrated Disease Surveillance Program. So what this program does, it looks for specific disease which may have a potential for an outbreak or epidemic. What are these diseases? Let us just look over it. First is acute watery diarrhea. Remember, right now we are in the 7th pandemic of cholera. The cases are low, but even a single case of cholera is very important. Then febrile illness. With only fever, the disease suspected is malaria. With rash, it could be measles or dengue. With altered consciousness, we have Japanese encephalitis and fever with bleeding tendencies, that is the dengue. Fever for more than 7 days, enteric fever or typhoid. Jaundice, hepatitis. Then cough for more than 3 weeks, that is pulmonary tuberculosis. Acute facet paralysis, that is for poliomyelitis. So if these kind of symptoms are present anywhere in India, the IDSP recognizes the symptoms and then starts its own investigation to decipher whether there is an outbreak or not. Now finally, we come to this. Just look at this picture. What is the ultimate goal we have? Is to save lives ensure biosecurity and stability. Biosecurity not only means the survival of the human beings, but also what we need, like food, shelter, etc. Those all come under biosecurity. Now, what are the pillars of these things? We have two pillars. One is the expert group, which can actually advise us on what to do and what not to do, and one other is the ethical group. Now, why these two are required? You see, not all measures which the expert group gives can be implemented. We also have to look at the humanitarian basis also. If somebody is affected with a disease, we cannot just kill him or her off. That is inhuman, right? So, along with the expert opinions, we also need the ethical and the moral group also. Now, what it leads to do is we need, with the help of coordination and communication, we need to go for surveillance and monitoring. What kind of diseases are happening, how to monitor them. Then we need to contain and control the disease process, be it the pathogen, be it the cases, be it the mode of transmission. What we need to do is we need to contain and control. The next step is we need to treat the patient, that is, save lives. That can be done with various aspects that may include from triage to expert intervention like critical care. The next important aspect is community resilience. Just treating the patients or educating the people is not enough. We need to make the people in the community aware. Ultimately, it's the community participation that interrupts the chain of transmission. So, we need to educate the community, train them, and make something called as behavioral changes. For example, if we cannot train the people in the community, we cannot actually prevent malaria. People will keep on keeping objects which will collect rainwater. Those will be the breeding grounds of the mosquito, and the disease will spread. So it needs a collective effort. So this is called as community resilience. And finally, a very important aspect is security and stability. We can plan huge number of things. We can dictate huge number of intervention, but all require, everything comes at a cost. So the government, the stakeholders, they must be prepared with the financial and support of the establishment to implement these things. Then only we can actually say that we are actually prepared for a pandemic which we can prevent, or we can uh, go through another pandemic.